Hello, I'm Dr. Satya Prakash, consultant gastroenterologist from Bengaluru city. I just wanted to highlight on some of the information on the inflammatory bowel disease for the common man. Inflammatory bowel disease is redness or inflammation of the intestine. It can affect any part of the intestine, starting from the stomach, small intestine, or large intestine. The common symptoms of inflammatory bowel disease are the stomach pain, constipation, or even diarrhea, sometimes loose motions with mucus and blood, and feeling of going to the washroom again and again. All these complaints sometimes preceded by a sort of not feeling well, to joint pains, redness of the eyes, and even skin rashes. Any of such symptoms related to intestine or even extra-intestinal symptoms affecting the eye, skin, joints also can occur. Any age group of people can suffer from the inflammatory bowel disease. We call them very young onset when it comes to the children between 2 to 12, 2 to 14, 16 years, and anybody can get later part of their life from 19, 20 onwards. That is a common adolescents and adults age group of patients. It's a common question from the patients that why I got the inflammatory bowel disease. There are several reasons for inflammatory bowel disease. Definitely there is an increasing trend of this disease in the community. Maybe about 20-30 years back to now, there is a tremendous increasing in the incidence. Maybe because of changing the lifestyle habits, changing food habits, and not able to do proper exercise, fast food eating. Majority of such habits together with genetic susceptibility make the patients prone for the inflammatory bowel disease. We can see there is so much of youngsters and children depending upon the fast foods and preserved foods, canned foods, and the obesity is increasing in the younger children. This actually is a stepping stone for inflammatory bowel disease later in their adults and adolescents. So the discipline in eating, exercise, and general well-being should start as a preventive measure from very, very young age onset. So when do you want to see a doctor? Indigestion, feeling bloating, and loose motions are a common symptoms in any average Indian citizen. But when the loose motions or stomach pain persists for a longer time and it affects their quality of life, and if there is associated weight loss, associated fever, presence of mucus or blood, they should immediately see a physician initially, and if necessary, recommendation to a gastroenterologist is a must. Usually the doctors, when specialists, when they come across these patients, after a thorough physical examination and history taking, the doctors usually advise a series of blood tests, some scannings to see their digestive system, and also recommend for a colonoscopy or endoscopy and imaging by radiology, by CT scan, MRI scan, or a compilation of all these blood tests, imaging, endoscopy. The doctors will definitely be able to come to a conclusion that what sort of an inflammatory bowel disease you are dealing with, and they can grade how much severe your disease is there, and they will recommend a set of medications which may include injections, tablets, supplements, even nutritional assessment. Everything is a part of management of inflammatory bowel disease. The common question is how long I should take the medication. Are the medications taking for a longer time are safe? But currently, the medications, whatever we are using it for inflammatory bowel disease, are very safe, tested for even young children to pregnant women to adults and even senior citizens. And whoever are taking multiple medications like diabetes, hypertension, or any other joint disease, they can combine in case if they have this also additional disease. These medications can safely be given with other medications they are taking for different illnesses. Even these medications are safe even in pregnant and even in the younger children. So there is no serious side effects with these medications of inflammatory bowel disease. Yes, there are certain conditions when the disease is severe, when the disease stays for a longer time, or when the disease occurs in very young children or adolescents or very young adults, they probably have an aggressive course. At that time, they need a little higher medications like immunosuppressives, biological agents, and the disease can be brought to control. Earlier days, we didn't had much medications, and the requirement of surgical procedures, including colectomy and ileostomy, were recommended. But right now, majority of the diseases, whatever severity they are, for a common man's purpose, could be controlled effectively. Once the medication is started, you need to see the doctor periodically as and when the doctor asks you to come for a follow-up. And the more number of follow-ups you follow, both in taking the medications, following the dietary advice, and taking the exercise as a part of your treatment protocol, majority of this time, you will be under perfect control of the disease. And as long as you are following the medication and then following the doctor's follow-up visits, you can live normally as much as possible without any much difficulty or disabilities. Yes, if you don't follow the medication properly, you are irregular in following, there are certain times where you end in complications, the intestinal hemorrhage, perforation, even incidence of cancer, other extraintestinal complications like liver disease. Cancers in other organs other than intestine can also come. So it is very imperative that you need to take the advice properly, regularly, and honestly. And even while you are taking these medications for inflammatory bowel disease, you can also take certain vaccines to prevent the superimposed infections, because when you are taking medications for this disease, you are prone for certain respiratory infections and then herpes zoster infections and hepatitis B. So you have to take vaccines as a part and parcel of medication and follow-up. The more you are aware of the disease and its outcome, more you know about the disease and its outcome from the doctor, you are well informed, and then you will have a normal life. Thank you so much.